A quiet professional medical office. Mackenzie sits nervously in the patient chair, clutching a water bottle. Dr. Stacy enters with a friendly smile and sits across from her.
Good afternoon, Mackenzie. I'm Dr. Stacy. I see here you've been experiencing some troubling symptoms. Can you tell me more about what's been going on?
Well, I've just been so tired all the time. It's like no matter how much I rest, I'm still exhausted and I'm so thirsty. I've been drinking water constantly and it never seems to help.
I see. Have you noticed anything else?
Yeah, actually, I've been eating a lot more than usual because I'm always hungry, but somehow I'm losing weight. And it's embarrassing to say, but I feel like I'm running to the bathroom every 30 minutes.
Thank you for sharing that. I know it's not easy to talk about these things, but everything you've described gives me some important cues about what might be happening. Have these symptoms been going on for a while?
Yeah, for a few weeks now. At first I thought it was just stress from school, but it's been getting worse.
That's good to know. These symptoms, fatigue, excessive thirst, frequent urination, weight loss, and increased hunger, are often linked to issues with how your body handles blood sugar. Do you have a family history of diabetes?
Not that I know of, but my mom did mention that my uncle had diabetes. I'm just not sure what kind.
That's helpful to know. Diabetes can have a genetic component, though not always. Based on your symptoms, I'd like to run some tests. We'll check your blood sugar levels and something called an A1C test, which measures your average blood sugar over the past few months.
Blood sugar, is that serious?
It's something we need to investigate further, but your symptoms could indicate type 1 diabetes. Let me explain what that means.
I've heard of diabetes, but isn't it from eating too much sugar?
That's a common misconception. Type 1 diabetes is different from type 2. It's an autoimmune condition where your immune system mistakenly attacks insulin-producing cells in your pancreas. Without insulin, your body can't regulate your blood sugar properly.
So what does insulin do exactly?
Insulin acts like a key. It helps glucose or sugar move from your bloodstream into your cells where it's used for energy. When your body doesn't make enough insulin, glucose builds up in your blood, causing high blood sugar. That's why you're feeling tired and thirsty.
That sounds serious. Can it be fixed?
There's no cure, but it can be managed very effectively with insulin therapy and lifestyle adjustments. First, we'll confirm the diagnosis with some tests. Once we have the results, we'll create a personalized care plan for you.
Okay, what happens if it is diabetes?
If it is type 1 diabetes, we'll teach you how to manage it step by step. It may feel overwhelming at first, but many people live full, healthy lives with diabetes. You'll have a whole team to support you, including me and Nurse Camila, who specializes in diabetes care.
That's relief. I just want to feel normal again.
And we'll work together to make that happen. Let's get started with the tests, and we'll meet again soon to get the results in the next step.
Hi, Mackenzie. I know this diagnosis can feel overwhelming, but I'm here to help you take it step by step. Let's talk about how to manage type 1 diabetes and what to watch out for.
Thanks, Nurse Camilla. I have so many questions.
That's perfectly normal. Let's start with the basics. First, you'll need insulin since your pancreas isn't producing it. You can use an insulin pen or a pump. Have you seen how they work? Okay, so here's how you inject insulin. First, you find an area like the abdomen or the thigh, and you pinch the skin and you inject at a slight angle. If you use a pump, it continuously delivers the insulin through a small tube under your skin.
How do I know how much insulin to take?
Good question. We calculate it based on your blood sugar levels and the carbs you eat. That's why monitoring your blood sugar is so important. You'll either use a glucose meter or a CGM. The CGM tracks your levels throughout the day, and a glucometer is for checking manually. You'll get used to doing this before meals, after meals, and when you feel off.
And what happens if my blood sugar gets too high or too low?
Let's talk about that. High blood sugar or hyperglycemia can make you feel thirsty, tired, or confused. It can also cause long-term damage if not managed. Low blood sugar or hypoglycemia can make you shaky, dizzy, or sweaty. Severe cases might even lead to fainting. That's why you'll keep snacks like juice, candy, or glucose tablets handy. With practice, you'll recognize the signs and know how to respond. Now let's talk about complications and prevention. Diabetes can affect multiple parts of your body, so we'll do regular head-to-toe assessments. Let's start with your eyes. So looking at this eye model, high blood sugar can damage the tiny blood vessels in your eyes, leading to something called diabetic retinopathy. We'll refer you to an eye doctor annually to check for this. And then looking at that foot, next your feet. Diabetes can cause neuropathy, which means numbness or tingling. It's crucial to check your feet daily for any cuts, sores, or infections. Since you might not feel them, they can get worse without you noticing.
I didn't realize diabetes could affect so many areas.
Yeah, it can. That's why regular checkups are so important. Let's also check your blood pressure and cholesterol. Diabetes increases your risk of heart disease, so managing these is part of your care plan.
This feels like a lot to remember.
It's a big adjustment, but you're not alone. Your healthcare team will guide you, and with consistent care, you can prevent complications and live a full, active life.
Thanks, Nurse Camilla. I feel a bit better knowing I have support.
Absolutely. One more thing, living with diabetes can be stressful, so don't hesitate to reach out for mental health support if you need it. Managing your emotional well-being is just as important as your physical health. I'm going to give you this booklet. It's your guide to living well with diabetes. A few days later, Mackenzie is at home with friends, checking her glucose levels.
Hey Mackenzie, what's that gadget you're using?
It's my glucose meter. I just scan it to check my blood sugar levels. Nurse Camilla taught me how to use it. Right now it's a 110, which is perfect.
What happens if it's not?
If it's too high, I take insulin, and if it's too low, I grab a snack. Managing it takes practice, but I'm getting the hang of it.
That's impressive. You're like your own health manager.
Pretty much. It's all about balance, and I've got a great healthcare team helping me.
Dr. Stacy's office. Mackenzie sits across from Dr. Stacy, looking healthier and more confident.
Mackenzie, I've reviewed your progress over the last few weeks, and I have to say, you've done an incredible job managing your diabetes. How are you feeling?
Much better. At first I was overwhelmed, but now I feel like I'm starting to get the hang of things.
That's wonderful to hear. Learning to manage diabetes is a big adjustment, but you've shown determination. Tell me, what's been the most helpful part of the process?
Honestly, having a plan. Nurse Camilla's guidance on using my insulin and monitoring my blood sugar has made a huge difference. I also feel more confident eating out because I know how to count carbs and adjust my insulin now.
You've done so well, Mackenzie. It's not just about understanding the tools, it's also about staying consistent, which you've clearly embraced.
Exactly. Diabetes management is about finding a routine that works for you. Let's also discuss what to keep an eye on moving forward.
You mean like complications?
Yes, but remember, the goal of managing your blood sugar is to prevent those. Keep checking your feet for cuts or sores, monitor your vision, and stay on top of regular checkups. With your commitment, you're already reducing the risks.
And don't forget, managing stress is just as important. Your mental health is key to staying on track. Joining a support group or connecting with others living with diabetes can be really empowering.
That's a great idea. I think talking to others who understand what I'm going through would help a lot.
Absolutely. There are so many resources available to you. Online forums, local support groups, and even apps that connect you with others.
I'll look into that. Honestly, I was scared at first, but now I feel like I can do this.
You're not alone, Mackenzie. You have a whole team here to support you. We're just a call or a visit away if you need it.
You've come so far, and I'm confident you'll continue to do well. Diabetes is part of your life now, but it doesn't define you. With consistent care and a positive attitude, you can accomplish anything you set your mind to.
Thank you both so much. I feel ready to take this on.
That's the spirit. Let's schedule your next follow-up, and in the meantime, keep up the great work. You've got this, Mackenzie.